Hello and welcome back to the Practice Nurse Mentor. I am with you again for another video, and in this one I'm going to be discussing in a little bit more detail about how to conduct a menopause health assessment. Now obviously that is a bit more of a bigger heading when it comes to what this health assessment is about, but for the sake of not taking up too much space on my title page, I just condensed it to menopause. But we know that it's perimenopause, menopause, and there are a few other extra um, situations where you can also do this assessment as well. But I'll go through that in a minute. So I have already touched on this before in other videos, which you may have already seen. But now that we've had a chance to be doing them a little bit more, I've kind of fine-tuned what I do and what I've been mentoring other nurses to be doing. So I thought I'd put it all together in a bit of a concise video and go through what I'm doing and how it's working and I guess expand a bit more on what the health assessment is available to do, and how you as the nurse can be integrating some of these ideas hopefully into your practice as well. So let's get started. Okay, so here's a couple of things that we're going to be covering in this video. I'm going to outline what this menopause health check actually is inclusive of, and how we, understanding how important the practice nurse's role is in helping our GPs to conduct these health assessments. I have heard a lot of information about GPs who are not getting their nurses involved in this, that they're just doing them all on their own. I think that is cray-cray, and I think it's doing the woman a very big disservice by not having that fuller team of people on her side as she's going through this. But I'll talk more about that as we get going. So we're going to identify the elements of the health assessment where the nurse can really utilize their skills, because we're really, really bloody good at doing health assessments because we've had a lot of practice. We have been doing those over 75 ones for a long time. We've been doing a whole bunch of other ones for a long time. So we have truckloads of experience in doing health assessments, and we know what we need to do. This is going to help fine tune that specifically for this target group, but we know what we're doing. So it just blows my mind that the GPs are choosing not to, and I have my theories about why, but I digress. What else we're going to be covering is the importance of planning for success with doing these health assessments, because it really does help a lot, I've discovered, in how we can get really good momentum with these assessments by using some of the tips I give you in this video. We're also going to talk about education opportunities and some resources and some ideas for helping to promote these health assessments. So I initially had this slide right at the end, and then I decided to bring it right to the very front, because if you're a nurse that perhaps hasn't got a whole lot of knowledge and understanding about perimenopause and menopause, or ovarian insufficiency and those kinds of things, which is what we're able to do this health assessment for, then I strongly suggest that you look into doing some education on this topic. Now, there's a couple of choices that I have popped in there, which are probably the most common and probably the most thorough. You've got the free one at Jean Hales. Jean Hales, if you haven't familiarized yourself with that website, go there now. Oh, no, not now, not now, but after this. And and check it out, because there is a wealth of resources there, not just for us health professionals, but also for women who are going through various health issues. So they're very strong on promoting women's health. So menopause stuff is just one aspect there, but also goes through like fertility stuff and things like that too. So they've got a lot of resources. There's posters, there's little video clips and things like that that you can also use and download, and you can use them in your practice. And I'll talk a bit more about that at the end when we do talk about how to promote this stuff. But yeah, it's a wealth of knowledge. If you haven't been to that website, please go ahead and do so and check it out and save some stuff on your desktop because it's really, really good. So they do offer a free course for nurses and understanding menopause for nurses and midwives. It goes for about an hour-ish. So it's not huge, but it is a government-funded one as part of this whole menopause package that the government has introduced. And so you can go along and do that for free. Then there's the family planning one, which, as you can see there, it does cost $250. It's several hours worth of training. It is obviously a little bit more in depth. There's stuff to do, learning modules to do of your own, and then there's online stuff too. So if you want something a little bit more rounded out, then maybe that won't be the one to do. Get some extra education points there. It does cost you some money, but keep your receipts obviously for tax time because it's all worth it. So yeah, it's if you're of an age, and this is by no means sort of disrespectful, I'm just simply stating that you may be of a younger generation that just doesn't understand much about menopause. Sure, we hear about it. We hear, the funny memes, and there's the videos about menopause is going around now. Some of them are really funny, and we don't care movement, which is hilarious. But so you may have heard of it, but you may not know how much about it, and you may not know how much of a significant milestone this is for a woman, and even in that perimenopausal stage. And menopause, it's a bit of a misnomer. There ain't no pause, mate. There ain't no pause. It don't pause. It may ease off at some point, but the woman will be experiencing some of the symptoms associated with menopause for years and decades to come. So it doesn't just go start here and end here, and with a whole bunch of uncomfortable in the middle. Sometimes there is a very long period of time that this woman is menopausal. So yeah, to get a bit more of an understanding about that, go ahead and do some learning, and talk to your mother, talk to your grandmother about it, or other elderly people that you know. Elderly people, I can't believe I just said that. People in this menopausal age group. And like, I'm in this, okay, I'm 54, I've been through menopause, and I'm on the other side of the big bad part of it all. But I do experience some symptoms still that are ongoing, even after I've gone through the horrible parts. But so yeah, I'm putting myself in that elderly category. But anyway, you gotta laugh. All right, so let's move right along before I put my foot further in my mouth. Okay, so now let's have a quick look again, review this. I've gone through this before and you're probably very familiar with it, but just to be clear about what is included in doing this menopause health assessment, this is the descriptor from MBS Online. So some points there that we'll be including. It's got to be a minimum of 20 minutes, okay? And I think there's also a little bit of a maximum. We'll talk about that in a second, but these are the bits and pieces that have to be included in order for the doctor to submit the 695 item number. And we're going to go through some of those things now. And you'll also note as well that what the price was. If I just go, I can't go back. It was $101. All right. So for that reason, I think it's a bit more cost effective. I don't know, as much as I really dislike having to put a dollar figure on this, but this is the world that we live in and we're in general practice. It does need to be kept under about that 40 minutes mark. Now it's $101.90, but that's without adding on a bulk billing incentive. So hopefully your practice bulk bills this for a woman, and you can add that bulk billing incentive on as well. So that will bump up that a little bit more. So let's just say 45 minutes. And that really gives, like, you could do this like a 30-minute session with the nurse and then 15 minutes with the doctor. However, if you do not have the luxury of doing that in your practice, then maybe having to look at doing 15-20 minutes with the nurse and 15-20 minutes with the doctor or something like that. Now, because we have got this little bit of a time constraint, the planning is going to be the key, and I'm going to explain that a little bit more as well. And also, this can be billed annually, and I will also point out, I haven't put that on the slide here, but it also can be billed in the same year as other health assessments. Okay, so again, I'll talk about that a little bit more as well. So just a couple of pertinent points with regards to that descriptor. Okay, so some of this is probably pretty obvious, but I've put it in here because unfortunately, we sometimes have to justify why we should be involved in doing health assessments, particularly this assessment, because I think some of it is because it's new, and we didn't really know too much about what it was. It's like, bam, there it is, and we can now do this health assessment. It's like, okay, and not really sure how we can structure it into our system of doing health checks at work, in our workplace. The traditional way is that it's done shared between the GP and the nurse. Okay, nurse doing predominantly the most amount of work, and then the doctor. So I think there was a bit of a knee-jerk reaction. Not sure how this is going to go. Oh, we're only getting paid $100 for this. Oh, we're not going to get the nurse to do it because it just doesn't make any sense. Sorry, but I'm going to disagree. It makes a whole lot of sense, and here's why. We are able to spend a little bit longer with that patient. So therefore, we have a bit more, it becomes more of an improved efficiency and workflow. So why is this any different to how we're already doing health assessments? You're seeing this woman to start off this health assessment. The GP is already seeing somebody else in the room at the same time in their room. And then you simply swap over at the end. And when the woman's finished with you, they then go see the GP for the next part. And it all just flows on really nicely, the same as it does when we do all the other health assessments. So I don't know why this one has to be any different. And it certainly shouldn't be any different. We are involved very heavily in this planning and preparation stage as well. Okay, so this is time saving. We are sorting out what needs to be done usually ahead of time, and we're prepping with getting some information before that person's got their bum on the seat in our room. So all of this is saving time. If this was just sitting in front of the doctor and expecting this to be all done by them, things will get missed, and I don't think that it would be as thorough in general. Okay, I know that there are some brilliant GP general practitioners out there who do amazing jobs with doing all this. They're very, very capable, but in my experience, world actual experience, the majority of the time the nurses do a fair chunk of the work with the health assessment stuff. We are involved in the information gathering, and this is where we're sharing this workload between the doctor and the nurse. So it's not up to just one person to be doing this whole thing themselves. We're then collating all of this information, bringing it all together. We go through, we're getting this and we're getting that. We're looking at making sure they've had their bloods done. We're looking to see if they've had all of the other bits and like screenings done and all that stuff, bringing it all together, summarizing it into our notes, in our session notes, and then the GP can open this up and have a look and go, right, well, I know where I've got to start next. How is this hard? We are also super, super involved and important part of building rapport and cultivating trust with our patients. We do this all the time. We do this every day. When we're doing the health assessments, we're spending the time with this person. We're hearing them. We are taking notes, okay? And I mean that figuratively as well as literally, okay? We're listening, we're understanding, we're getting this holistic view of this person and what is going on from that. And this is super important for this menopause health assessment, because we want this to be a holistic approach. We want to have a really big understanding, as big as possible, of what this woman is going through. Okay, so it's this more holistic and integrated team approach, and overall, this is going to give us more improved patient outcomes and satisfaction with knowing that they've got someone who's listening to them, because I can guarantee you there's going to be people who say no one's listening to me, that I think I'm losing my mind. Am I going crazy? I don't know. Nobody cares. Nobody listens. We need to be part of that team that's listening to them and helping to facilitate them through this period of their life. So if none of those are telling you that you need to be getting your nurses involved, if you happen to be a doctor listening out there, then I don't know what's going to convince you, mate. All right, so planning ahead, the key to success. Here's where it gets interesting, guys. So I've worked on this over the last few months, and I have done several of these now. Just in the last week alone, I've done 3 across a broad spectrum of women here. So I've been fine tuning this, and so this is kind of how I've been doing it. Okay, this is not set in stone. You can use or not use parts of this however you wish and however it's going to work in your workspace, okay? This is just my guidance to you. So, ideally, the woman has been seen by the GP and they've recommended that they come in for this health check, okay? Perhaps she said, oh God, I've got some things going on. I'm finding it hard to focus. She's getting into this perimenopause phase. So perimenopause means that we're sliding into it, okay? This can start at varying ages. Just last week alone, I had someone who was 38. And I've also had plenty of people in their early 40s that are starting to experience some of these symptoms. So sometimes, this can really creep up on people as well. So hopefully they've had a bit of a chat to the GP. It's like, okay, maybe we might need to look into this. So they may have then said, let's get you booked in for this health check. So then the woman goes out and books at reception, and that's where they're given their pre-assessment pack. And we just have like a nice big envelope, A4 envelope, and inside it, there's a few things for them. Now, I'll show you what they are, and I'll talk about what they are and go through them with you. But you can also include some other things if you like. You can pop onto the Jean Hales website and you can print off some other useful pieces of information about what is menopause, for example. Yeah, you can feel free to add whatever you like into this pack. But I just think it's really nice for them to be given this stuff as a planning ahead kind of a phase. So in it, I have put in, there's a fabulous little questionnaire on Jean Hale's website called What's Bothering You? And I'll show you this. I've got it on the next slide. Okay, so wait. So what's bothering you? It's a quick little tick off where they can talk about, some of the signs and symptoms that they're starting to experience, and on a scale of what's what or how much it's affecting their day-to-day life. Okay, so that I think is an absolute must to include in a sort of pre-assessment of them, because remember, we've got some limited time. So using this pre-assessment pack helps to do some of this information gathering that you don't have to do on the day, and you'll see what I mean. Okay, so I also include a DAS 21. Now, if you're savvy enough to want to do all of this electronically as well, instead of handing them a hard copy pack of something, you can email it to them if you've got the skills to sort that out electronically. That's not me, but it might be you or your practice manager, whoever. then they can get a DAS21. I prefer personally the DAS21 because it looks at the depression and anxiety as well as stress. So just because someone is feeling a certain way, it doesn't mean that it has to be necessarily pigeonholed into one thing or another, but the DAS really kind of helps to categorize sort of where they're leaning the most towards. Is it stress? Is it depression? Because maybe it's not perimenopause, maybe it's something else. But we also really underestimate the influence that hormonal changes will start to have on a woman's mental capacity, state of mind, all of that sort of stuff. Like, do not underestimate it, please. Because I'll kill you. No, don't underestimate it. Really, really think about it as a very important aspect of what they're going through. So I always include that. And then I think a customised questionnaire based on the Australian Menopause Society Practitioners Toolkit. Now, this is another resource that you need to go and have a little bit of a look at. Even just the first few little section of it, where there's some really good flow charts, and just to sort of help you understand how we go from assessment to treatment and monitoring and maintenance and stuff like that. Some of it's going to be a little bit in depth in terms of medication and prescription and stuff like that. So I'm not saying you have to be proficient in that, because that's obviously the doctor's territory. But being familiar with some of the types of treatment, whether it's hormone replacement or not, then I think that's really important if this is an area that you're going to be doing a fair bit of in your workplace. So again, in the next couple of slides, I've got examples of these, okay? And again, just do it however you think is going to work best for you. This is just some examples. Use them the way they are or adapt them to however you wish. But I've been using these and they have been really, really useful in collating that information for me. And then I don't have to spend as much time with them when they're actually sitting in front of me, going through and trying to get all of this information, which can sometimes take a bit of time. There should also be perhaps a pathology request form, obviously, to go get some bloods to have a look at thyroid, their hormone levels and things like that. So that's ideal to have that given to them, hopefully by the doctor, as part of this planning phase to get them in to do all of this sort of stuff before they then come in for the assessment and then, checking into where things might be at. So that can all be in the pack, okay? And then instruction, obviously, to complete these things before they come in for their appointment and to bring that information back as well, the questionnaires, I mean. So, as I said, some of this is really great for helping to gather this information prior to the appointment. It gives them some time to think about things a bit as well, rather than being put on the spot. So tell me some things that are bothering you the most. Oh God, where do I start? Well, and if you've talked to any perimenopausal, most menopausal women, you'll know that sometimes the brain fog or the memory is a little bit, how you going? So asking them things on the spot might not necessarily always sort of yield the most accurate results. So having some time to think about it, and they've got a week or two to fill in these forms and really be honest and upfront about the information that they're going to provide, I think is a really good, and it has worked really well. I've had that feedback from women going, this was great to do this all beforehand, because then I could think about it and I didn't have the kids hanging off me, or I didn't have work problems to be worrying about or anything like that. And I think it also takes some of the embarrassment out if they can just write it down and slide the piece of paper to you. Rather than going, I don't know if I feel okay about saying that I've got some vaginal dryness. But, there's lots of different reasons why people might feel a bit awkward having these conversations. So this helps, I think, a lot. Okay. So here's the examples. So that's that what's bothering you form. So as you can see there, it's really nifty little tick 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 box, very similar to the DAS. If you haven't seen the DAS before, that's it there. There's 2 pages to it usually. There's a second page that shows you how to do the calculation of the scoring and that. So um, however you wish to present that is, I'll leave that with you, but that's just what they look like. Okay. Um, this is I think it's about page 5-ish of the Menopause Society Practitioners Toolkit. And so this is an example of some of the flow charts. That's the word I was after. Flow charts. So this is the one I was talking about, that if you want to use some of this information points to gather if you want to create your own like screening form or template, because this is the kind of history information that we want to be getting. And we're also going to be helping by doing some of these observations and excuse me, some of the investigations and things like that as well before the doctor comes to the diagnostic part. All right. So that was just, I really just wanted to show you. If you check out that, you can just go, if you just do a Google search for the Australian Menopause Society Practitioner Toolkit, you'll find it. It's a pretty big document, but really valuable information there. Save it on your desktop. Okay, so this is an example of how you could put this together this is just 1 page. I've just had to cut it in half a bit to show you on here. But this is just a 1 page. Don't make it too complicated, but very simple tick, tick, tick. And then they can bring that in there with you. With them on the day, and you're gonna go through that with them when they come and sit with you. Alrighty, so some of this information may or may not be relevant. Some of it you may already have on file, depending on how long this person has been coming to see your this particular GP or attending your practice. They might be relatively new to the area or something, or they've just not been to see the GP too much in the past because, hey, they've been young and fit and healthy and well. So, yeah, it might seem like some of this information is overkill, but you may need to help sort of fill in some blanks in some of your demographic information that you've already got about this person in their file. And obviously some of it's really relevant because we want to know, especially some family history type things and any other medical certain histories that they have as well. Alrighty, so that's just an example. And as I said, I based that largely off that previous slide where I showed you the flowchart from the practitioner toolkit. Okay, so following the recommendations. So then on the day of the assessment, the woman's come in, they're sitting with you, you're going to review those questionnaires and you're just going to make sure that if you need any clarification on some points that you're just going to go through and ask some questions to sort of help fill it out a bit where you think it's necessary to do so. You're going to perform and record their obs, so their height and their weight, and you can probably have a bit of a conversation about, well, do you feel like you have put on some weight over the last little while, and if so, how much has they put on weight? You can make a note of that. And then we're going to also just check in on their preventative screening status, so their cervical screenings, their mammograms, if they've started doing mammograms yet. If they're 40 plus, then they should be starting to look at these kinds of screenings as well as their bowel screening. So making a note of those kinds of things. And here we're going to do, and I say brief SNAP, which is your smoking, nutrition, alcohol, and physical activity. Some of these have already been included on that other form, the smoking and the alcohol and the physical activity. You can flesh that out a little bit more if you want to, if they've ticked yes or no, some of those things, then you can obviously expand upon that a little bit more. But here might be where you talk a bit more about nutrition. Do they consider what do they consider their average diet to be? Do they eat fruit and vegetables regularly every day? So they're getting enough fiber in their diet? Are they having enough calcium? Those kinds of things. I often just say, tell me about a normal day in the life of Jane, from breakfast to going to bed at night. And I just sort of make a few quick notes that, eating, protein most meals and a variety of fruit and vegetables, blah, 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 whatever. Or has a poor diet in that they're eating a lot of fast food, eating on the run, not sitting down and eating regular meals, things like that. So, and I, no judgment. This is all part of the holistic assessment of where things are at for you, so that we know how best to approach the treatment and management of what you're going through. So now, the thing I want to stress here as well, because I've had this comment to me as well about when I'm saying about a brief thing. Now, this assessment is a stepping stone on the woman's journey through menopause. There is absolutely no way that all the information and the treatment and all the management is possibly ever going to get done in this one session. It's impossible. Okay, it's just not going to happen. But we have to work within the tools that we have given to us in general practice, and it's the stepping stone, because there are other things that we can do down the track to expand upon this. Okay, and you'll see this in my next points, where now they go off and they see the GP. The GP reviews all this information that you've collected and put together for them. Then they talk with the woman and they formulate a plan for management and treatment. They're reviewing all of their results and things like that from bloods, determine if they are going into perimenopause or they're in menopause or whatever, and working out a plan of approach to manage these things. Then they're going to organise some follow-up appointments. Now, that might be in the form of coming back and seeing you for a chronic condition management plan, because menopause is a chronic condition. Or perimenopause into menopause is also a chronic condition. So there's absolutely scope for them to come along and have a plan, and then we can look at doing some allied health referrals to support them, or some specialist referrals if necessary. They might also need a mental health care plan if they are in this, there's a really big change of life happening here and they need some mental health support to help them navigate that. 100%. So then there's also other health assessments that can also be done in the same year as this particular health assessment. So while the 695 can be done annually, they may also be eligible for other time-based assessments or a heart health check. Okay, so they can all be done within that 12-month period, the same 12-month period, as long as they're eligible for those things and they meet the criteria for that, then they can absolutely go and do that. So there is absolutely no reason why, if a woman is 45, that they can't come in and have this perimenopausal check and then come back at another time, and we can do a bit more of a fuller 45 to 49 midlife health check. And there we can expand on the patient education side of things. There we can expand on pulling through some more nitty-gritty with their nutrition or their physical activity, or other risk factors, and looking at, are they at risk for osteoporosis, and education around preventative measures for that, etc. So, and the same with the heart health check. We can bring them in for that, and we can start making sure that from a cardiovascular perspective, because we know that changes in our hormones are also going to have change on our cardiovascular system, then we can bring them in for that as well. So there are going to be plenty of opportunities to expand upon what is happening for this woman by accessing other services available to us and reviewing them down the track as well. So obviously getting them in for a chronic condition management plan, then we're going to open up access to having those 3 monthly reviews with the doctor, even if it's not with the nurse, but doing it with the doctor and reviewing how their treatment is going, reviewing their hormone levels and all of those kinds of things. So that's what I mean by this is the stepping stone. It's not the be all and the end all of it's a one and done. I'm just going to chuck this woman a menopause health check and we pop her on some hormones and off she goes. That's not the way it's going to work. Okay. Ideally, the most holistic and integrative healthcare that we can give this woman is by including some of these things that I'm suggesting here now. So So some ways that we can help promote this health check, apart from obviously having those engaged conversations and those opportunistic discussions, whether it's the GP doing that or you doing that. Um, you know what? Maybe even it's the other way around. Maybe they've been booked in for you to see you to have a 45 to 49-year-old health check, and in the process of that, they've started talking about these things, and you go, I wonder if perhaps we're heading into this menopausal phase. Then you can recommend that they come back and they do the menopause health check. So it can work both ways. It can all happen that way. So, but yes, having the conversations and having those opportunistic times where you can talk about that this is available to them, or recommending it. So you can set up some displays in your waiting room. You can have some targeted posters on women's health. If you've got a little TV thingy in your waiting room, then perhaps look at doing some your own video or putting some slides up on there about that, and pop it on your practice's social media pages if you're engaged in that way, on your website, all that sort of stuff. Pop it in your women's health section. That menopause health assessments are available. Speak to your doctor about it today. Those kinds of things. Posters about women's health. Put them in all your clinical areas, in the ladies' bathrooms, in the waiting rooms, and obviously in your treatment rooms and your consult rooms. Have it right there so that they can see it at any time. And those things sometimes will prompt conversations as well. Advertise that you are doing free menopause checks. I'm hoping, that you are offering the free menopause checks with the 695. Okay, some practices are not doing any bulk billing. That's not up to me, obviously, and that's sometimes out of your hands as well. But if you're a practice that does bulk bill your health assessments, then promote that this is a free health check. And maybe you can put it as a bit more of a question and answer style of a poster. Do you experience hot flushes, foggy brain, muscle aches and pains? You might be experiencing menopause. Talk to your doctor about your symptoms today. Something like that. Do up some posters and have that kind of thing around so that they can see it. You can also do some targeted invitation, and so you can use that through your electronic messaging services, whether you've got HotDoc or what other booking programs that you might be using. You might be able to send out bulk messages into target groups, age groups, and things like that, or emails or something, or you can do the old-fashioned letters, and you can go and do a data search for women in this age group, and you can send it. I think the thing with that is it's a bit difficult because people can be going through this at any age. And as we know from the descriptor as well, it's also about people who might be struggling to conceive, and they go and have some tests, and it's all about, they've got the estrogen insufficiency, that they're not, sort of producing it, and that would warrant having a health assessment in this category as well. So I think it's a bit hard to target, but by all means, you can certainly put out a batch target, and then the other more generic stuff around it with your promotional information in the waiting room and what have you. But if you certainly want to target specific group of women, you might be able to go 40 to 50, not 40 to 50-year-olds as a baseline, and just put it out there, I suppose. Okay, so hopefully that's given you some ideas on how you might be able to integrate this into your practice a little bit more. So thank you so much for joining me once again. I do love doing the video. Sorry, I'm a little bit off the wall sometimes, but this is me. And so, yeah, if you do want to find me lurking around in Facebook, I am on a couple of the practice nurse pages, the big one, the Australian General Practice Nurses page, and there's a couple of other ones as well that I'm also regularly participating in. So you will often find me lurking around in there. So by all means, say hi if you see something that we've posted or commented. And obviously my YouTube channel, please, you're probably watching this video here. I'm going to upload it there. So you're probably watching it on YouTube. And so if you are, do me a favor and like the video so that I know that it's reaching the people that it's meant to go to. And please share it amongst your colleagues, because this is my goal, is to just get it out there to as many practice nurses as possible. And if you do like the content that I'm producing, please subscribe. And I'm always open to feedback and for some ideas or suggestions on some topics that you would like me to cover in the future. I do have some planned ones, but I'm really, really happy to address certain things if you drop me a comment or something like that. Okay, so thank you so much once again, and I will catch you on the next one. Bye for now.